Hi, Katie.
Hi.
How are you doing?
I'm pretty good.
Wonderful.
Yeah.
So you're here about 6 months after your last visit.
Yes.
Okay. Can you please verify your last name for me
Sure, it's ASMR.
and your date of birth?
March 23rd, 1989.
Perfect. Okay. I'm going to perform your gynecology exam.
Okay.
And can you please verify your phone number?
Sure, it's 555-968-2156.
All right, we're gonna go ahead and just take a family history first, and then we'll do personal medical history.
Sure.
Okay. So now we're gonna focus if anyone in your immediate family has trouble with the following disorders that I'm going to mention, and that includes mother, father, sister, aunt, or grandmother.
Okay.
Okay, any clotting disorders,
No.
breast disease,
My mother.
okay, high blood pressure,
No.
blood clots,
No.
osteoporosis,
No.
okay, or heart attack before age 50.
No.
Okay. Were you ever diagnosed with anemia?
No.
Do you have frequent headaches,
No.
migraines?
Not really.
Okay. Diabetes?
No.
Any thyroid problems?
No.
Okay. Do you have any shortness of breath?
No, not really.
Okay. Do you smoke?
No. I used to, but not anymore.
Okay. Do you drink alcohol?
Yes.
All right. How often?
I would say like a couple of drinks every other day. So moderate.
Okay. And do you exercise regularly?
Yes.
Okay. How often?
So I run for 20 minutes every other day. So pretty light, but consistent.
That's good to know. All right, let's go ahead and go into gynecology history. Any pelvic disease? Okay. Any surgeries?
No. No.
Have you ever had an abnormal pap report?
No.
Okay. Any positive HPV test?
No.
All right. Have you ever had an STI?
Yes, herpes 1.
Okay. Any vaginal infections?
No.
And did you have the Gardasil vaccine?
Yes.
All doses?
Yes, yeah.
Do you remember the first day of your last menstrual period?
It was like last month around this time, so it was like December 14th, 15th. Yeah.
And are you pretty regular?
Yeah, yes.
Okay, would you say how many days in between?
In between periods, I'd say about like 28 days. Yeah.
Are you experiencing any problems?
Not problems, but my breasts are like very, very sore lately, and it's been in between periods too, as opposed to like right before my period. So that's kind of why I'm here. I want to get that looked at.
Okay. Is it both symmetric?
Yeah.
Any other symptoms?
No.
Okay, are you experiencing any abdominal discomfort or cramping?
Yeah, I get heavy cramping before my period, during, and I actually have an IUD in, and I'm wondering if that's like contributing to the cramping or not.
Okay. It could be one of the adverse effects of an IUD. We're going to go ahead and check placement and see if it looks okay, and we'll go from there.
Okay.
Okay. Are you sexually active?
Yes.
Okay. So currently you're using the IUD as a form of contraception, correct?
Yes.
Are you using anything else?
Condoms.
Okay. Alright, we're gonna go ahead and start the physical exam. The physical exam involves taking your vital signs, so doing a general examination since it's been a long time that we've seen you. And then we're going to do a breast exam, make sure that we're checking for anything abnormal, abdomen, and pelvic.
Okay. All right. Thank you.
You're welcome. I'm gonna go ahead and sanitize my hands. This will go under your tongue.
Okay.
Can you go ahead and hold it for me, please? Thank you. I'm going to place this on your index finger. Okay, go ahead and open. 96.3. Is it okay if we use your left arm?
Yes.
Okay, I'm gonna have you relax. Blood pressure looks very normal.
Okay.
Okay. Heart rate is 62, oxygenation 99% on room air. Blood pressure was 125/70. Do you know your approximate height?
5, 4.5. Yeah.
And approximate weight?
115, 120.
Okay, are you taking any medications?
Yes, I'm taking trazodone at night to sleep.
How many milligrams of that?
100.
Anything else?
No.
Do you have any allergies?
No. That's what I can think of.
Okay. I'm gonna go ahead and put some gloves on. I'll start by examining your neck and your lymph node. I'm gonna go ahead and put gloves on. Okay, and I'll start by palpating your neck.
Okay.
Palpating preauricular lymph nodes. Postauricular. Moving down the jawline, and we're checking submental lymph nodes. Tracheus midline. And now we're checking thyroid. It's a very important gland that helps us regulate our hormones. We're looking for any enlargement or nodules. I'm going to have you swallow a few times. Okay, perfect. That's okay. I did not feel any nodules. And it seems to be normal size. Is it okay if I open up the gown a little bit? I'm going to have you shrug your shoulders. Relax. Okay. And is it okay if I palpate your armpit as well?
Yes.
Okay. I'm going to start with this one first.
Okay.
Go ahead and place your hand behind your head. Okay, very good. And we'll do the same thing on the other side. Go ahead and relax. Okay. We're gonna go ahead and examine your breast now. Is it okay if I open the gown a little bit more?
Yes.
Okay, so we're looking for any asymmetry or discolorations. Okay, both breasts look symmetric. I'm not seeing any abnormal colors. Alright, I'm going to start by palpating your right breast now. Okay. I'm going to use a very slow circular motion. If you're having any discomfort, let me know.
Okay.
It doesn't really matter what way you go. Usually just try to go in a circle so that you can make sure that you're not missing any spots. It's very good to do that usually when you're in the shower. And the warm water usually helps to relax the vessels. And the consistency of the breast seems to be a little bit fibrous, but that's not entirely abnormal since you are right before your period. Okay, I'm gonna go ahead and examine your left breast now. So we're gonna do the same thing using a circular motion. I'm not feeling any nodules. Okay. Everything looks very healthy as expected. I'm going to go ahead and have you lay down now and we'll examine your abdomen and your pelvic area.
Sure. Thank you.
I'm going to go ahead and open your gown. I'm going to listen to your heart as well. This is going to feel a little bit cold. I can hear only S1 and S2. No S3, no S4. I can hear only S1 and S2. No S3, no S4. I'm going to switch and listen with the bell. So we're trying to see if we hear any murmurs. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. Breath sounds are normal. I do not hear any crackles squeezing or wrong eye. I'm going to go ahead and open the gown, so we'll take a look at your abdomen, okay?
Okay.
Okay, this is going to feel a little bit cold. Going to listen in all 4 quadrants. We're going to break us. Looking for any enlargement. And I'm going to palpate. Let me know if you feel any kind of discomfort. Again, we're looking for organ enlargement, any cysts. Going to palpate your uterus to see exactly if it's in the right position. Okay, normal size, non-tender. I'm going to go ahead and palpate your right ovary. Gentle pressure there. You're going to feel. I'm not feeling any enlargement. Good. And now your left ovary. Gentle pressure there. Everything feels normal. Good. We're going to take some measurements. For any asymmetry, which would indicate some inflammation. Okay, we're going to move to the last part of this exam. Okay. I'm gonna go ahead and lift the gown up. Okay. I'm not seeing anything abnormal. Color is within normal limits. Nothing swollen. And no abnormal discharge. I'm going to go ahead and insert a speculum. First, I'm going to use a lubricant. It's sterile. This is going to feel a little bit cold. Okay, now you're just going to feel my fingers and the speculum going in so that we can visualize the cervix. Okay, good. Speculum is in. I'm just going to go ahead and enlarge the area a little bit. Good. Okay, we're preparing the field to do the pap smear. And I'm not noticing any cysts or abnormal discharge, which is good. Okay. Now we are going to take a sample. It's going to feel like a pinching sensation. I'm going to let you know before I do that. You might see some abnormal discharge in the next 24 hours. It might look a little bit pinkish in color. Okay. On the count of 3, I'm going to ask you to take a deep breath in. 1, 2, 3. And breathe out. Very good. Now that we've finished with the pap smear, we're going to go ahead and test for gonorrhea and chlamydia. Okay, you should not be feeling any kind of pain here. Good. I'm going to apply an antiseptic spray. Okay. Now this spray is also going to help with any burning sensation that it's absolutely normal after a pap smear. This is going to go external. Very good. Okay, how are you feeling so far?
Good. Thank you.
Perfect.
Yeah.
I'm gonna have you get dressed now, and we're going to talk the results.
Okay.
I'm gonna go ahead and take these off. I'm just going to write down everything that we did today.
Okay.
Okay, your thyroid looked good. Lungs sounded clear. Abdomen was non-tender. S1 and S2. No S3 or S4. Extremities were good. Beetle pulse was normal. 2+. Okay, breast exam. I'm gonna send you for an ultrasound just because I saw some fibrous tissue.
Okay.
And we want to make sure that there's nothing abnormal.
Okay.
And then the external area did look good on the pelvic exam. I did not see any abnormalities such as vulvitis or any discharge.
Okay.
Bartholin cysts were also normal. I know you had some concerns there, but
Yes.
nothing swollen today.
That's good.
Okay, and for the test that we did, so I'm gonna contact you with the pap smear results. We took chlamydia and gonorrhea tests as well.
Okay.
And that, would you like us to contact you by phone?
Phone would be
Is good?
best.
Okay.
Yeah.
Can you go ahead and initial here?
Sure. Here you go.
Perfect. Do you have any questions for me?
No, thank you. This was very, I feel very comfortable and safe, so thank you.
You're welcome. My pleasure.
All right.
I will see you back soon, okay?
All right, see you soon.
Take care.